This is a difficult scene to witness. We are seeing students assembling out in the parking lot as they were.
I don't even know, to be honest. My mind was everywhere. I was like so shocked, like this happened. I seen it, you know. And
How many times we report these stories, you do not ever think that you're going to say goodbye to your child in the morning and send them off to high school, and you never think that this is how the day is going to end.
I'm Amy Andrews, here with my friends from the Sports Marketing Agency and the Oakland Community Health Network. We are here to provide support for our community after the tragic shooting at Oxford High School and mental health resources.
We've been hearing a lot about mental health and trauma in the aftermath of the Oxford High School mass shooting, and it's a conversation that needs to continue, our conversations about mental health in general. Right now, Dana, a lot of people are still reeling after this tragedy. The shock is still there for some, but some it's wearing off. Tell us about how the first week has been for your organization in terms of response. You guys have been there whenever anybody needed you.
With this week's traumatic event and just the tragedy of what happened last week, our team was boots on the ground. So we brought together our crisis counselors along with provider crisis counselors who actually went into the school to begin to work with those families, those students, and the administrators that were a part of this tragic event. As the public community mental health system, and we're responsible for services for this community. And that includes people we serve with intellectual and developmental disabilities, serious mental illnesses, and children with serious emotional disturbances, and substance use disorder as well. We provide a network of providers who are ready and skilled to address those issues and concerns.
And it's interesting because, of course, I work on the news and we interview mental health experts afterwards, and everyone had great advice and things to talk about, but you work directly with the people involved in Oxford.
Yes, and you know, what I will tell you is a sense of gratitude and appreciation. Those students were trained, and so they saved lives. So the focus really hasn't been on that so much right now. The focus really is the shock of it all, and really addressing and recognizing that this is something that you cannot walk away with feeling anything but sadness and a great deal of fear. We're dealing with a lot of students and families that are very fearful, and what does that mean for their future? And how do we safely get people to understand that this is not a normal event, and so we have to put in those supports and services that can help people begin to heal.
I do want to take it back just a step two. We talked about you stepping in, your teams would step in from the pandemic. There was already a response to these kids who were not starting school, they weren't in school, they weren't doing these first, and now some of these, the same generation is experiencing this trauma. Just how important are mental health resources going to be going forward? We know they are critical right now,
Right.
But even more so moving into the future.
I think the pandemic represented one layer of trauma and loss for children and youth and young people in general. Now you have whole nother level of unimaginable. I think in some ways we sort of begin to accept that we're in this pandemic and it's changed the way we go to school or we go to work or how we are able to be with our family. And now here's another really, really traumatic thing to happen to young people, even if they weren't directly involved in what happened at Oxford. Kids were already struggling, you know, and how do they express themselves and how do they get that socialization some of them so need. Some kids thrived during the pandemic because they didn't have to go and leave their home, and they enjoyed that. They're introverts and they enjoy being at home. But all of us, to a certain extent, we're fatigued. So here we go with this major, massive event. And I think the real point in that is really talking about things openly and talking about what really has happened to our children in the last 20 months and in the last week. And having those open dialogue conversations, not to blame or to point fingers, but really talk about the emotional reaction and responses we're having as adults, and then mirroring what that looks like for children. They're looking at us as guidance. So how we treat each other is guiding them on how they should treat each other and support one another. So I think that's very critical, that we begin to have these open and honest dialogues and really talk and stress the importance of mental health, stress the importance of substance use and abuse, stress that people understand things differently on different levels, and how do we make sure we're communicating that? And some of it's cultural, and understanding that some cultures never ever talk about mental health, but this crosses those lines, and so we all have to begin the dialogue on that.
Thank you to our community partner, the Sports Marketing Agency, and our collective endeavor to make Oakland County and our communities safer and more informed.